Good morning to those who have just joined us. We're just going to wait one more moment for a few more people to join in, and then we'll get started. Okay, it's 11:01, so we will start. So good morning, everyone, and thank you so much for joining our virtual STEGH Talk session. Just a few quick things to note before we begin. In an aim to reduce background noise, we're going to be muting everyone except Dr. Garcia and Monica. If you have any questions during the presentation, please type them in the chat field, and we'll try to answer as many questions as we can during the Q&A. This session will be recorded and shared at a later date on our Facebook page and YouTube channel. On behalf of the STEGH Foundation and the hospital, we welcome and thank you for joining us for today's virtual STEGH Talk session, a continued celebration of Medical Laboratory Week. It is my absolute pleasure to introduce Dr. David Garcia-Marquez from STEGH's Department of Pathology and Monica Olanski, Vice President of Patient Services. STEGH's clinical laboratory plays a crucial role in patient care as the majority, if not all, medical decisions are based on laboratory results. Dr. Garcia and Monica will give an insider look on the structure of STEGH's clinical laboratory, including biochemistry, hematology, transfusion medicine, microbiology, and histopathology, as well as the wonderful people behind the laboratory and new and exciting updates. Thanks so much for joining us today, Dr. Garcia and Monica. Take it away.
Thanks so much, Kenzie. Actually, thank you very much for your kind introduction and for organizing this talk, and especially for helping me to navigate through my technological ignorance. So yes, we are here today to talk about the lab, but I would like to use the first moments of this presentation to thank the foundation for the work you guys do. It's amazing. Your presence can be felt actually in every corner of the hospital. Thanks again for the support that you have given to the lab through the years, especially buying expensive pieces of equipment that have improved our output in a great deal. And also, thank you for the opportunity you are giving us to talk about who we are, what kind of work do we do, and why our work is important for our patients. Now, I have to be honest, it's not very hard to talk about something that you're passionate about or something that you are proud of. So when we got this invite to talk about the lab, we actually got very happy. And I would say that the main reason is that most of the work that we do is basically occurs in the background, right? So almost, I would say, completely anonymous. There is very little direct contact with the patients that come to the hospital, with some exceptions. For instance, when our lab assistants go to draw blood, and I believe that for some, that's not a very nice experience. But anyways, however, despite that anonymity, there is hardly any diagnostic or therapeutic decision made in the hospital that is not based on results provided by the lab. But the patients basically don't see that because their interaction is mostly with nurses and doctors. So what is important to say is that behind each of those tests, there is a lot of work. There is a clerical work. There is somebody who is receiving the specimen, entering the system. Then there will be a highly trained, qualified technologist using state-of-the-art equipment to come up with a result that is also validated to the higher standards. So pretty much what I'm trying to say is that our patients, when they get their lab results are getting the highest level of care. And this happens 24 hours a day, all around the year, so we never stop. So we saw this talk as a good opportunity to explain the fundamentals of the work that we do, also who we are, and just try to transmit the passion that we have doing this work. Our presentation mostly will have two big parts. I will start by doing a little bit of information about how the lab is structured, examples of different tests done in every of the areas. I promise you we can probably run into some big technical words here, but I will try to be as simple as possible so that everybody understands. And the second part will be based mostly in the people who work here. And some exciting changes that have been happening for the last few months, and some even more exciting things that are going to happen in the future, in the near future, actually. And Monica will take care of that. I want to say that under Monica's guidance and efforts, those has been instrumental for all these changes to happen. We are very happy that she is our vice president, and there is no better person than her to explain these changes to you. But I'm going to start now with the structure of the lab. I hope you can see that with no issues. So basically, there are 5 divisions or departments in our lab. And those are biochemistry, hematology, transfusion medicine, microbiology, and histopathology. So let's go through all of them. So the first one, biochemistry, perhaps, and I say this because I ran into trouble yesterday when I said that it was the busiest department in the lab. Some parents, oh, no, hematology is the busiest one. But okay, then I changed my presentation, say likely, just to, I want to hurt anybody's feelings. But it's a very highly automated department with big, complex equipment. They receive a lot of samples every day, high volume of tests. Examples of these tests are, for instance, liver and kidney function tests. So to see how the liver and the kidneys are working in different conditions, like individuals who have chronic kidney disease or diabetes or other conditions that can affect these organs. Blood glucose is very common, especially important for diabetics, and it will determine the amount of blood sugar in a given sample. Cardiac enzymes are also another test that frequently is done. Of course, this is used frequently to determine if a person is having a heart attack, or to follow how the treatment for those patients is working. Hormones are also important part of these tests. And I put down here beta HCG because this is one important one. Sometimes it's necessary to determine if a patient has, for instance, an ectopic pregnancy that, if not treated quickly, could bring very complicated conditions. Also to follow, for instance, the development of placental diseases, etc. Vitamins are other measures that we can have in this part of the laboratory. And I put down B12 because, you know, more and more there are people who don't eat meat, and if they don't take care of these enzymes, sometimes they will be on the low end of the spectrum. Now, all these exams are done in the non-cellular component of the blood. The next department, which is a hematology, pretty much study what happens with the cells in the blood, which are the red blood cells, the leukocytes, and also the platelets. Now, examples of these studies are, for instance, the CBC, or complete blood count, that is very common. It's pretty much ordered in every patient, and will determine the amount of cells, many different cells in the blood. The hemoglobin concentration, important, for instance, in cases of anemia. The coagulation, very important, is important in both extremes of the spectrum. Some people have excessive coagulation that can lead to clots, embolisms, etc. Others, on the contrary, clot very poorly and needs this to be addressed. And it's also a very important tool to monitor and control individuals who have who are under blood thinners for a long time. So it's important to see if the amount of those blood thinners need to be modified for the benefit of the patient. And of course, there are also several blood conditions like leukemia, hemophilia, etc., that can be diagnosed with the use of this department. The next one is transfusion medicine, and well, this is very self-explanatory, but the most important part of this department is to guarantee that the blood product that a given patient received is the proper one, so to avoid transfusion reactions that can be really severe. So they do the blood typing, the ABs, etc., or the antibody screening to determine that that blood is free of possible antibodies that can cause damage to the body. They have a very important function in trauma patients that potentially might require large amounts of blood. And also, and this is probably another way that there is a better contact of our workers with the patient, is that they can provide, some patients would have specific diseases that require subcutaneous or intravenous infusions of immunoglobulins. They can come to the lab and they will receive these products for home use. It's important that also is used in different patients that are going to have a transplant or already had the transplant, and they have to monitor their immune system. Microbiology is another department. Part of this department is pretty much the actual tests are not done here anymore. We are in a partnership with LHSC, and probably 4 or 5 years ago, this part of the lab went to be performed at LHSC. However, we still collect specimens, identifying, matching, and tracking the specimen, and send them to LHSC for analysis. Also, we have the responsibility to communicate with public health in cases that some probably contagious diseases are identified, like Lyme disease, parasites, venereal disease, etc. And this is the best part. Well, I'm just joking, but I'm biased because I'm a pathologist. But histopathology is also part of our lab. And pretty much what we do is a study of all tissues and organs that are removed in the ORs or in our clinics. One of the main goals is to determine if a given process is just an inflammatory process or if it's a neoplastic process, cancer. In cases of cancer, we also provide a lot of information in terms of how far that cancer has gone in the patient, what is the possible prognosis, the best way to treat this patient, and that make us very good friends of pretty much every physician in the hospital, because the surgeons, the dermatologists, the gynecologists, you name it, everybody will send us specimens for us to analyze and give them guidance on how to treat these patients. And that's pretty much the biopsies, because the other component of our work are the autopsies. And autopsies, unfortunately, have decreased in amount in the last decade, probably 20 years. We still do them, but not as many as we did in the past. Probably the cause of this is that many patients, when they pass, already the diagnosis has been made, given that we have more and better diagnostic media, but still autopsy is a quality control tool that is important in the evaluation of the provision of care in hospitals. These are average numbers of the amount of tests that we perform every year. As you can see, there are big numbers, and which make us a really busy laboratory. Sometimes these numbers might be actually bigger in terms of that we are struggling sometimes to find people to work here. And it's not because we have a bad lab or we are bad people. It's just because right across the country, there is a lack of lab techs for some reason. And it's very hard to recruit new people. But for the most part, we have an amazing group, and we are very proud of working with them. Everybody's very proud of the work they do. And yeah, that's pretty much what I wanted to say on this part of the presentation, and I will pass the baton to Monica.
Okay, thank you, Dr. Garcia. What an excellent presentation. And I as well would like to thank the Foundation for all of their support that they provided to the lab. We're very grateful for that. And without you, I'm not sure what we would do. So a big round of applause to the Foundation at STEGH. Dr. Garcia certainly talked to the technical components of the lab, but my part of this presentation is going to be on our people and more on the human side of the lab, and really wanting to make the invisible visible. Our people are our greatest asset, and without them, we would not have a lab. I've been at STEGH since May, so almost the last year, and it has been a real pleasure working with everybody in the lab. I've learned so much from this team, and I certainly appreciate I have so much more to learn. I never thought it could be exciting and passionate, and my passion for the lab is starting to grow as well. And again, it's through looking at the lab through the lens of the staff, and they're so committed to the work that we do. Our team, it has about 40 people. We've got MLTs, laboratory technologists, MLAs, assistants, clerks, secretaries, and our pathology assistants and our physicians. And each person on our team plays such a critical role in ensuring the success of our lab. You know, when we think about safety, quality, auditing, blood drawing, as Dr. Garcia said, when the team has to go out on the floor, you know, managing equipment, we've got highly state-of-the-art equipment that needs to be managed and well taken care of. The team is really good at building a culture within the lab. And then the other great thing about this team is that we need to have fun, and they have fun. The work they do is fairly intense and complicated. So it's nice to see when the team can bring some humor back to the team. And I also think about, you know, when people think about the lab, they tend to think about equipment, so microscopes, advanced lab equipment, process, logistics, testing. And again, we may forget about the highly skilled individuals that actually put this all together. And really, they're the ones that are helping doctors detect diseases, illnesses, and determining treatment options. And really the nucleus in terms of what we're doing for our patients across our organization. But what is really critical with that is that, and I think sometimes people may forget that yes, they're not touching our patients directly, but they are 100% patient focused. It's all about our patients and what we do here. And they take such pride in the work that they do. And it's almost palpable when you walk into the lab. And you know, I'm very proud to say I'm part of this team now because of the work that they do, and that patients are at the cornerstone of everything that we do day in and day out. And quite frankly, they make our physicians' lives a lot easier and our clinicians, because our turnaround times are great and the quality that they are able to produce is second to none. Again, I just want to, you know, the team is phenomenal here at STEGH. Do you want to go to the next slide, Dr. Garcia? So last week was National Medical Laboratory Technologist Week, and the team did a great job in terms of doing some fun things. And I was down in the lab, and a few people had written why they chose to work in medical laboratory. So I took a couple pictures of some, and I thought I'd share them today. And this is only a snippet of some of the ones that were posted. And I was telling some of the team, it was quite emotional reading these. And I'm just going to read a few of these. So I chose to become an MLT because I not only love patients, but I love the science, facts, and mystery of how the human body works. This career path allowed me to combine two passions. This is the best job ever. I've always wanted to do something to help people. Working as a lab technician has given me a balance between patient care and lab work. I couldn't think of anything else I'd like to do. I love science, and if I can help someone take care of them, then it's better. It's an added bonus. So, I mean, explaining the why is such a great testimonial to the work that they do. And I wish I could have shared all of them, but these were the ones that jumped out to me. So they were quite moving. And again, I think you can just feel how passionate the team is that are working in our labs day in and day out. Want to go to the next slide? So we're really excited about our future, and our future of the lab really aligns with STEGH's strategic plan, STEGH's Imagine 2023. I'm just going to touch upon about 4 areas that we're really focused on over the next couple of years. And the very first one is enhancing our partnership with London Health Sciences Centre and POM, so the pathology and laboratory medicine. And Dr. Garcia spoke to that briefly. So back in 2019, our lab created a partnership in terms of microbiology services. And what that has done is it's helped to improve our turnaround times, and it provides information back to our clinicians in a timelier manner. And it's also strengthened our relationship with POM. Because that has gone so well for so many reasons, we ventured on a new partnership this year, in February of this year. And now we've expanded that partnership where we have medical scientific support for biochemistry, hematology, and transfusion medicine. And what this essentially means to our organization here is that we can leverage medical scientific support 24/7. And this is very helpful for our physicians if they have a key question that needs to be answered. It helps with our turnaround times if we require consultation. It also allows for standards and standardization across our region. And for those of you that don't know, this partnership also works out very well because with London Health Sciences Centre and 10 other hospitals, we all share the same electronic health record. So the ability to see information in the moment is very, very timely. We share one record. So this enhancement of what we're doing with POM really aligns with our electronic health record. It also helps with increased collaboration, and it's really great for the team that they also have skills and expertise in London, and London or POM can rely on our skills and expertise that we have in-house here in STEGH. So this partnership is really a great thing. We're really happy that we've embarked on this. And I think the other piece of this is seeing how the pandemic has played out. It's really made us think about our workflows differently and how do we work with other hospital partners to improve the patient experience and leverage on each other's skills and abilities. Our next big project that we're working on is our lab accreditation. which is scheduled for this coming up fall. Accreditation is done every 4 years, similar to hospitals, and we follow the Ontario Laboratory Accreditation process. I will tell you, which was new to me, the accreditation process for the lab is just as cumbersome, complex as it is with a general hospital accreditation, and that was new to me. A hospital accreditor may spend 3 days at an entire hospital, and they probably spend 2 days in a lab. So it makes you appreciate the complexities of the lab. As an example, our lab has over 8,000 policies and procedures, which is probably more than most hospitals. So again, it speaks to the intrinsics of the lab and all the work that goes on behind it. Second to that is, 4 years ago, we received exemplary status, and we are anticipating the same as we move into 2022. And there's a strong team within the lab that is supporting the accreditation, and we're very fortunate to have that skills in-house. Our lab is moving, and I see Kathy's on the line, Kathy Jameson. She's the project lead for this move, and we're very, very excited about the move that's happening. It's sometime next year. I don't want to give definite times, but somewhere spring, summer, we're hoping. And the team has been really excited about this, and it's been in the planning phase for quite some time. When we move, we're looking at new equipment, the ability to expand and grow. We've got about 6,000 square feet in our current space, and we're going to be leveraging the same in our new space. But the layout is going to be so much more from an efficiency perspective. Tons of work going on with that. And again, to thank the foundation, because they've been critical as well as a partner to see this move actually come to fruition. Another exciting thing, and I love when we think about digitization in a patient care environment, is the lab is constantly looking at ways to how do we advance our lab through digitization. As with any other hospital or private industry, everybody's thinking of ways, how do they use digital health tools to help optimize, increase, enhance the patient experience and create efficiencies. So again, as part of our move, we're going to be having new and updated equipment, and the goal will be to help digitize as we move along. We're doing lots of great work in the lab right now in terms of digitization. We've got some new platforms that are coming on board with our policies and procedures, and looking to do some other really innovative tests that will allow physicians to receive results in a timelier manner through auto verification. And again, we can rely on our EHR to help us support us in that work. So our future looks bright. Our future looks amazing within the lab here at STEGH. We've got a fantastic team. And again, my goal here was to say it's not just the microscope. It's not just the advanced technology. It's the people that's actually operating this equipment that really makes our lab so unique and so mindful in terms of how we want to advance patient care, how we support our clinicians, and how we do such great work day in and day out. So it's our people. I can't speak to it, and really, I also want to give kudos to Dr. Garcia. He is really the pilot of this airplane. He's leading the charge. He is a great role model for the team, highly engaged with the team, and just a sheer pleasure to work with. So I hope that gave a good overview of our lab in terms of the people side of the house. So I'll turn it back over to you, Kenzie.
Amazing. Well, thanks to both of you for that very engaging and passionate presentation. We can obviously see that both of you are very passionate about the work you do at STEGH, and we're very lucky to have the laboratory that we do because it's so critical in diagnosing patients. And thank you for your recognition of the foundation. We really appreciate it, but it's truly our donors that make these amazing things happen at STEGH. We're so lucky to have the supportive community that we do, and they make wonderful things happen here within the halls of STEGH. So again, thank you so much for your presentation. I would now like to open it up for questions. So if you have any questions, please feel free to type them in the chat box or unmute yourself, whatever you're comfortable with. We do have one comment I'll share from the chat box, which everyone can see, but what a terrific team. Very proud and pleased to have you all working within our community. Your work and contributions matter. Great presentation. So that's very nice. Thanks for that.
Yeah.
Thank you.
Please feel free to ask any lab related questions you may have or anything about testing. Monica and Dr. Garcia are very happy to answer anything. Okay, so we have one in the chat box now. When and where is blood tested when donated or brought in?
Sorry, can you see the, repeat the question, please?
When and where is blood tested when donated or brought in?
Well, I believe that the blood is primarily tested at the donation centers. And when the blood products come here to the hospital, they are already typed and everything. So pretty much ready to go. What we do here is pretty much to match that blood product to the patient who's going to receive it. So to prevent any reactions. But the blood products we receive have been already tested for antibodies and pretty much they are ready to use.
Amazing. Thank you so much, Dr. Garcia. I'll ask a question. So how has your team kind of been involved with COVID and the assessment center and kind of the swabs, if anything? What's been going on kind of on your end of things?
Well, as I mentioned, the analysis of the microbiology test, and that falls into that category, is done at LHSC. However, the collection of the specimens and registering of those tests and submitting them to London is our responsibility. And that's been really a very challenging task to do because, well, you can imagine for this probably more than 2 years now, the amount of tests that we had to process and send on the daily basis. So it's been very challenging.
I can add a bit to that, Dr. Garcia, and I think, a year ago or longer, the team could be managing about 200 specimens a day, and certainly the numbers have, decreased a bit, but it is still complex works, and a lot of it is the tracking. And that's so critically important that all information is tracked properly because, you couldn't imagine if the numbers didn't align, you didn't have the right patient, especially with swabs that are so sensitive. And the other nice thing about, the work that we're doing is, again, a lot of it is digitized, and it's great that we have one EHR that we're using, and I'd say we're a leader in that piece. But as Dr. Garcia said, the tests are processed in London, but it takes a lot of critical thinking on the labs team to make sure the swabs get from point A to point B in a very methodical manner. So they've done a tremendous job in terms of managing that additional work that is critically important. And I don't want to lose sight of, how important their role is in that facilitation.
Amazing. Thank you so much. We do have another question in the chat box. So would it be feasible in the future to have a collection center right at our hospital, or will St. Thomas citizens always need to have lab work done at clinics like Life Lab?
Monica, I think I will leave that to you. I don't know. I have no answer for that.
That's a very interesting question. And Public Health Ontario certainly has a role within our communities. And they certainly offer a great service, and they play a critical role. The hospital labs play a different role. And it's very clear in terms of what the lab can support and what in Public Health Ontario can support. Those conversations are certainly at a different level, more at a provincial level. And right now it's very clear in terms of who gets what and where does vital information get sent to in terms of reporting processes. The POM in London as well certainly has a bigger footprint than we do here in London, and it might look different in London Middlesex area. But right now for our region, Elgin County, it's pretty clear in terms of the delineation between what PHO receives in terms of their lab samples and what we receive here within our STEGH environment.
Thank you so much. Another comment, so labs are such a vital part of ongoing patient care and community care. Your compassion when dealing with patients is absolutely amazing. Definitely proud of your achievements and outstanding staff. That's very nice.
Thank you.
Thank you.
If there's any more questions, please feel free to type them in. Otherwise, we will end that amazing presentation on that note. So Dr. Garcia and Monica, thank you so much for sharing your knowledge and expertise with us this morning. Your presentation was very engaging, and what a perfect way to continue to celebrate Medical Laboratory Week. If any viewers have comments, questions, or general feedback, please feel free to email us at info@steghfoundation.ca. We will follow up with you with a link to the recording, and please feel free to share it with your family members and friends. STEGH Talks is a series of presentations that the Foundation in partnership with the hospital will be hosting regularly. In celebration of National Nurses Week in May, we have a special presentation being given by Craig Watkin, who is Vice President of Patient Services and Chief Nursing Executive. So stay tuned for that exciting announcement. And thanks again for spending some time with us this morning, and we hope you all have a wonderful day.
Thank you very much. Thanks again, Kenzie. Thank you.
Thank you.